The topic is dental waxes. Coming on to introduction. Variety of waxes have been used in dentistry for specific and well-defined purposes. They are used as patterns for inlays, crowns, pontics, and partial and full dentures. Waxes are very useful for bite registration purposes. Advantages. It is uniform when softened. Color contrast is good. Not fragments into flakes when softened. Not pulled away or chip on carving. No solid residue. Rigid and dimensionally stable. It is a high precision via low shrinkage. Optimum viscosity at 89 to 91 degrees Celsius, 192 to 196 degree Fahrenheit. Precise fitting copings with an even layer of thickness, high stability and elasticity, contains no acrylic additives, easy to cut off the preparation border. Now coming on to the disadvantages. Internal residual stresses. It can be divided into thermal properties and crystalline structure of wax, method of forming the pattern, handling, length of the time, and the temperature and the storage of the wax also matters. Thermal contraction may not be fully exhibited immediately after cooling, followed by solidification of the surface layers of the wax well before the bulk becomes rigid. This will reduce the magnitude of the thermal contraction and produces significant internal stresses. Hence, dimensional changes may occur due to the relief of the stresses. Now coming on to wax distortion. It can be due to release of stresses, contraction on cooling, occluded gas bubbles, change of shape molding from manipulation, carving, pulling, removal. Indications. Improve the contour of perforated tray for hydrocolloids, to stabilize a pontic for the temporary bridge while index is being made, to build up walls around the impression to produce a desired size and form of the base of the cast. To adjust the contour of perforated tray for use with hydrocolloids, to raise the flange of the tray, extend the tray posteriorly to raise the palatal portion of the tray. Joining metal parts before soldering, joining of fragments of broken denture prior to repair procedure, record the relationship between maxillary and the mandibular teeth. It records the mucus and underlying tissues in functional state in distal extension mandibular removal partial dentures, recording the PPS area for intraoral impression of patients with cleft lip and palate. Thank you.